Unit 3, Chapter 14, Symptoms and Signs. Exercise 14.1, complete the table with words from C opposite. Put a stretch mark in front of the stretched syllable in each word. The first one has been done for you. Now, adjective. Exhaustion, exhausting, fatigue, fatigued, lethargy, lethargic, tiredness, tired. Exercise 14.2, make word combinations using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sorts, put on, present with, worn out. Exercise 14.3, complete the sentences with the correct form of the verb present. Number 1. A 67 years old man presented with a 9-month history of increasing shortness of breath. Number 2. The most common presentation, loss of consciousness. Number 3. Cranial arthritis may present as fever without any obvious cause. Number 4, the patient usually presents with a severe sore throat. Number 5, the presenting symptoms in this patient could therefore be due to renal failure. Renal failure. Number 6, other conditions with a similar presentation include acute cholecystitis. Again, number 6. Other conditions with a similar presentation include acute cholecystitis. Number 7. Reduced growth is an important presenting complaint of celiac disease. Number 8. 2 months following presentation, the patient was able to walk. Exercise 14.4. Read the patient's description of her symptoms, then complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I've been feeling completely worn out and the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 13. A 50 years old housewife who had been well hunting for months previously complained of tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her GP, although she dined eating more than usual. She was constipated and she noticed that her hair had started to fall out. Chapter 15, Exercise 15.1. Find words in the box with opposite meanings. Look at B and C opposite to help you. Adequate, inadequate. Against, for. Unlikely, likely. Severe, mild. rare, common, sudden, insidious. Exercise 15.2, make word combinations using a word from each box. Look at B and C opposite to help you. Bone marrow, differential diagnosis, insidious onset, iron deficiency, iron deficiency, pernicious anemia, progressively increasing, vibration sense. Chapter exercise 15.3, complete the sentences. Look at A, B, and C opposite to help you. Number one, third, number one, 39 years old man presented with a history of progressive abdominal distension over a period of 6 months. Number two, blindness may be caused by vitamin A deficiency. Number three, the bleeding and purpura are caused by abnormal platelet function. Number four, the white cells count is normal. We can include acute leukemia. Number five, the yellow color of her skin and conjunctiva is probably due to jaundice. Number six, there was a there was a palpable mass in the right upper quadrant of the abdomen. Number seven, treatment is aimed at restoring fluid balance with adequate intravenous fluid. Number eight, the anemia may be due to increased red cell breakdown. Exercise 15.4, complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem starts quite suddenly, so it didn't have the typical insidious. He doesn't have any skin onset pallor, and he doesn't have insidious onset paresthesia or absent chimerical sense, and I couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or vibration sense. Chapter 16, Bones. Exercise 16.1. Label the diagram using words for the box. Look at A opposite to help you. Number 1, skull. Number 2, jawbone. Number 3, spine. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number 7, shoulder bone. Shoulder blade. Shoulder blade. Number 8, thigh bone. Number 9, kneecap. Number 10, shin bone. Okay. Exercise 16.2. Mark the types of fracture with the descriptions. Look at B opposite to help you. Number 1, open is A. There is a break in the skin. Number 2, comminuted. Letter C. The bone is broken into several pieces. Number 3, displaced. Letter D. D is the broken pieces are separated. Number 4, green stick. Letter B. The bone is bent. It occurs mainly in children. Number 5, impacted. Letter E. The broken pieces are pushed together. Exercise 16.3. Complete the textbook extract. Complete the textbook extract. Look at C opposite to help you. Reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to hold in a displaced position, the fracture will hold, but it may go on to malunion. Chapter 17, Childhood, Exercise 17.1. Complete the table with words from A and C opposite. Then complete the sentences with words from the table. Verb, noun, adjective. Delay, delay, delayed. Develop, development, developing. Distend, distension, distended. Fail, fell, failure. Nourish, nourishment, nourishing. Number 1. Babies with the fetal alcohol syndrome may present with development to thrive. Number 2. Abdominal distension may be due to an enlarged liver. Number 3. Small amounts of alcohol in pregnancy can affect fetal failure. Number 4. Mortality from measles can be reduced by better nourishment. Number 5. Delay in one or more of the milestones may be the first signs of disease. Exercise 17.2. Complete the sentences. Look at A and C opposite to help you. Number 1. After sitting. Babies learn to crawling and then to walk. Number 2. A child who has started eating solid food has been winning. Number 3. Someone who is not very tall is said to be of short stature. Number 4. The stage in a child's development are known as the milestones. Number 5. A child who is beginning to develop sexually has reached puberty. Exercise number 17.3. Write the common English name for each disease using your medical knowledge. Number 1. Enlarged thyroid glands, MUMS. Number 2. Difficulty opening the mouth. Lockjaw. Number 3. Rash and a large posterior occipital nose, German measles. Number 4. Paroxysmal cough and vomiting. Paroxysmal cough with vomiting. Whooping cough. Number 5. Pupils and vesicles with on trunk, chickenpox. Number 6. Cough and cold followed by rash, measles. Number 7. Sore throat and rash, scarlet fever. Number 8. Swollen joints and a hard murmur, rheumatic fever. Number 9. Fever followed by muscle weakness, polio. Number 10. Cough with stridor, croup.